In Wales, there's been a lot of focus for our health boards, which are the PCT equivalents, on pre-diabetes screening, and practices have had practice members, GP and practice nurse, sent on motivational interviewing courses, and a lot of them have found it quite dispiriting that you identify people with pre-diabetes, you then put a lot of input into them, and then they don't come back for follow-up sessions. And I guess if you imagine that we have great difficulty getting people to adopt lifestyle change once they've got type 2 diabetes, then getting them to adopt it with the threat that they might get it, you might anticipate it would be less successful. But it's certainly a huge issue, and lifestyle is the reason for the epidemic of diabetes in countries like Saudi Arabia, for example. It's all down to lifestyle issues around no exercise, a sort of McDonald's type diet, leading to an explosion in childhood obesity. And once these kids are obese in their mid-teens, I think we've probably lost them in terms of making major lifestyle impacts. It's of interest that something that we find with the GLP-1 receptor agonists, for example, although they're advocated within NICE as third-line treatments, in a trial setting they're often used at a much earlier stage. And if you get a big impact on weight, then this often is a stimulus to adoption of lifestyle changes. And it's weight reduction is a very powerful incentive for people with type 2 diabetes, and having to go through a phase of putting them on medications that lead to weight gain, I think can often be counterproductive. And as these drugs establish a better safety record, and as presumably over time their price comes down, I'm sure we'll see them being used earlier in the treatment algorithms.